I'm an associate professor at USC School of Social Work in LA, and I've been there since 2006, and I focus my research on ethnocultural factors and severe mental illness and the cultural relevance of services.
Culturally based family intervention for Mexican Americans is a culturally based intervention developed for Spanish-speaking Mexican American families dealing with schizophrenia.
The take-home point of my work is that it is complex and necessary in that I work with families, and most research studies are focused on individual children, adults, whatever age group, and my work is focused on families. And so it's more complex because you're dealing with different ages within a family, different marital status, and so on. So there are many more variables to consider. But it's so important, and that needs to be done particularly in working with ethnic minority clients, because we come from more collectivistic cultures, and the family is our unit. We see ourselves as identified with our family culture more than an individual culture. So the cultural exchange process, and if you could just visualize the families coming in, and of course everything's conducted in Spanish, and everything that is done is the back and forth of recognizing strengths, talking with them about how that strength is operating in terms of the way they're coping with the illness, but also learning from them. And then they learn from us in terms of the illness. There are lots of myths around mental illness, and through the psychoeducational component, those are corrected. But also we did not dismiss their myths, but really started where they were, and then delved into them, and then appropriately provided the psychoeducation. We delved a great deal into the most salient domains that seem to be salient in every group. We conducted 2 intervention groups. Familism and spirituality were just in every session. They came up in different ways. Again, psychoeducation was something that they were eager for. We highlighted the principles of recovery, that this is a journey based on knowledge, hope, strength, and resilience. They often talked about faith. And it was like a breakthrough to learn that schizophrenia is a brain disorder, that it's no one's fault. And one of the things that we also did from the very beginning is I trained the interventionists to self-disclose, not in a way that burdens families, but in a way that connects with families. So the interventionist would say where she came from, what part of the region her family came from in terms of their country of origin, and how long had they been working with Latino families and in mental health, and if they had a family member with an illness, because we all do. And so that was something that was very much a connection for families. They were not used to at all to be included, but also to hear personal information to a certain level of the therapist.